Okay, we're going to get started. Welcome everybody to the Arizona Social Determinants of Health Program Roadshow. My name is Andrew Tarek. I'm the Director of Social Determinants of Health for Health Current, and we are going to be talking about our program today. So here's a quick rundown of everything we're going to discuss. A few housekeeping items. You probably noticed that you were muted upon entry. We ask that everyone remain muted throughout the presentation. Please feel free to ask questions in the chat at any point in time. We have people that are monitoring those, and we'll be pulling them out of the chat, and we'll answer those at the end of the session. And if you do not get your question answered today, we will have them send out in the FAQs in writing, and you could also attend a future roadshow as we continue to update these as we progress through this process. So first off, I want to talk about the program partnerships. So Health Current has teamed up with Access along with 211 Arizona, which is operated by the Crisis Response Network, and NowPal. We've come together to build a statewide social determinants of health referral system for Arizona, and we thank you all for attending today to learn more about this amazing collaboration. We're going to tell you about a lot of these great features and show you a demo and introduce you to this platform. In addition to our key partnerships, we have had over 30 organizations participate in our social determinants of health work group. This work group was really key in developing the different types of features and functions that are on the platform. We haven't convened the work group in some time, but we will be reconvening that work group again, because I know we've gotten a lot of questions here from parties interested in joining the work group. So we have had some people join that, and feel free to reach out if you are all interested. Really want to emphasize that this referral system and the product that we're talking about today will be a statewide solution for all Arizonans. You do not need to be enrolled with Access to use this system, and it is completely free to use. So there is no cost to adopting the system, or to using the system, or to having access to all the features. So what is the genesis of this program? So this program officially, the genesis of this program is part of the Access Whole Person Care Initiative, which officially launched in November of 2019. So Access launched the Whole Person Care Initiative to focus on the critical importance of addressing social risk factors as a key part of a person's health and well-being. So Access connected with community stakeholders and identified 3 key areas of need. One was transitional housing, particularly individuals leaving a correctional facility, those being discharged from behavioral health inpatient stays, and individuals experiencing chronic homelessness. Now, we know that these populations, especially when you're coming out of a facility, that is a time where addressing those social risk factors can be critical to preventing that person from returning to that facility or returning back into a similar type facility. And then people that are experiencing chronic homelessness, connecting them with those social determinants of health and addressing the social risk factors can really make a huge impact on that person moving towards getting housing. Non-medical transportation was the other area of focus that they identified, mainly with a focus on access to healthy food and employment navigation services. So getting people connected to places where they can get food and being able to get to work every day. And the third one was social isolation, which can impact individuals on long-term care or individuals that have chronic health conditions. But I think over the last year, we can also relate to the impact of social isolation has on our mental health and well-being. So here's just a slide that shows the definition of the social determinants of health. What I want to highlight is that research supports that if we address social determinants of health, we will have better health outcomes as a whole. So even if that means something simple, like for a person to attend their appointment, setting up transportation so that they can attend the appointment, or setting up childcare so they can attend the appointment, something small like that can make a huge difference in a person's ability to get their healthcare needs addressed. And this could also impact more life-altering circumstances, like a safe place to sleep at night. And if you consider how much that would impact someone's ability to attend appointments or get their other healthcare needs met. So it's clear that these social determinants of health and these risk factors really have a significant impact on people's healthcare. And when we solve for these factors, that impact people's social environment and give people a greater opportunity to succeed, they can live fuller and healthier lives. So what is our program purpose? So we want to build a bridge to connect healthcare providers and community-based organizations in order to address the social determinants of health needs of our community. We need to create more accessibility to services and streamline communication so that a person can get the help they need when they need it. So it's really building that community of not only healthcare providers, but our social service agencies, and creating a network and communication platform for all those services and organizations to work together to serve the community that is in need. And our second purpose is, with a greater focus on social determinants of health, we can make it easier for Arizonans to obtain essential social economic services, thus improving their health, well-being, and quality of life, making this that whole person care approach. And lastly, as we'll demonstrate today, this partnership will foster the rollout of a statewide technology solution that will facilitate the capturing of screening data and codes that relate to social risk factors. So it's really a data-driven approach, creating that data-driven approach and seamlessly refer members to community resources using results from screening tools. I want to just highlight one of our partners here, that 211 Arizona. They are operated by Crisis Response Network. They're a nonprofit organization that offers a continuum of crisis, referral, and data services, and they've been doing this work. So connecting individuals and families to vital social economic services and making an impact on people's lives. For instance, since relaunching their live answering services in March 2020, 211 Arizona has taken over 500,000 calls. They are an incredible partner for our communities, and we are excited to have them be a part of this SDOH program. And here's the proof, a testimonial of their work. Alice has 2 jobs and has been trying to apply for more assistance. 211 helped her set up an interview and to obtain her SNAP benefits. Since she was behind in her bills, 211 helped her with getting assistance on her utility bills, applying for benefits, and looking for job postings, basically trying to find a solution that would sustain the safety and well-being of her and her family. The SDOH referral system will be a key tool for 211 Arizona to streamline referrals for these various services to meet the needs of people like Alice and her family, and they will be able to do it all in one system. So let's talk about some of the program features. So you're going to see these in a demo in a little bit, but I'm just going to give you a high-level overview of them. So first off, we want to highlight the referral directory. And we talked about this in terms of building a universe or building your referral network. So the system will have the ability for organizations to onboard their referral network. And when we say referral network or referral universe, we're talking about the organizations or the providers that you're currently working with. So when you make a referral for housing, when you make a referral for transportation or food assistance, who are you using for that referral? And if you're a community-based organization, do you have a referral partner that you can send a person who has a healthcare need? So we'll be building those closed-loop networks. But in addition to that, to those closed-loop networks where you would get that referral feedback, and we'll talk more about that, organizations will be able to access the full 211 Human Services Provider Directory, which has over 35,000 services. So we're working with 211 Arizona to bring all of those services onto the platform. Now, I want to make it clear that this does not mean that we're going to be driving a whole bunch more referrals to those organizations. It's going to be the same process, except this will be a place where we can capture that information all in one place when making referrals. And if you want to do a closed loop referral relationship where you have to respond and close the loop on the referral, that is by choice. We wouldn't set that up unless organizations wanted to do that. So the next key feature is that this has a no wrong door approach. So no matter where the person shows up, they can be signed up for the system to use the system. When I think of the no wrong door approach, I really see this as a community effort. So it's all of us coming together to decide that a person in need comes before anything else. So we're not directing people to one place or types of places to get the help they need. Rather, we're coming together as a community with a commitment to help that person get directly connected to services no matter where they show up. So, some people, their only touch points might be certain community service agencies. And if that agency can identify a need and connect them to a healthcare service or something they're eligible for, that would be a big thing as well. So evidence-based screening, there is evidence-based screening tools built into the system. The one that we highlight here is the Prepare. However, there are several evidence-based screening tools in the system, and this platform does have the ability for a custom build of a screening tool. We could take a screening tool that's in the system and pare it down or modify it to match what your organization is doing. And there's also the opportunity to do a bi-directional interface with your EMR, so that if you're doing your screening in your EMR, we're bringing that Z code data onto the referral platform. So there are lots of different options. Of course, each option comes with different timeframes, but organizations can work with us. We work with Health Current to identify what's going to be the best solution around screening for them. Once the screening is complete, that will identify the key needs, and that will then generate a referral that will have all of those needs addressed. And an organization can take that referral list, and you'll see this in the demo, and send that to the client. And we can have referrals that are really tailored to those individual needs in terms of, what's their eligibility, where do they live, what's going to be the most convenient place for them, what are the closed loop partners, or what's within an organization's referral network. Maybe we start there, or maybe there isn't a resource and we need to go outside of the geographic area to find one. So all kinds of different metrics that can be captured there. In addition, there's that referral feedback. So if there's a closed loop partner, when you send that referral, the partner will indicate whether that referral is accepted or declined. The system will have alerts and communications. This is just a really great feature for providers and for clients to send alerts about appointments, or for organizations to communicate across the platforms. So if you send a referral to one organization and they have additional questions, you can communicate across the platform. We can send alerts to members, clients' phones, so that we can improve their ability to attend appointments and decrease instances where they no-show. And I know that, if you refer someone to 5 or 6 resources, having that alert can make a big difference in terms of whether or not a person attends that service. There will be a data analytics and outcomes and dashboards feature in the product as well. This can produce individual provider and organization level service reports and dashboards. One of the biggest benefits of using a system that captures all of the referral data and SDOH coding is that organizations can aggregate and analyze that data and use it for quality improvement, gap analysis, and business intelligence, all of which will make us a more informed community that can better serve those in need. And lastly, there will be a client portal. This is a separate application that clients can use to search for services. And we'll be working over the next year with NowPow to connect that client portal to the referral network. So you'll be able to have a view into clients' self-referral activity to really reinforce that self-directed care and foster greater client activation. So we're just going to very briefly talk about what this would look like from a use case as a service requester versus service provider. So if you're a service requester, first, as we talked about, you could onboard that preferred network or build that preferred network. When a client hits your doors, you can find their unique profile in the system, or with that no wrong door approach, you could sign them up. Then they can use their own built-in screening tool or identify the needs or just identify the needs and immediately connect that need to an available resource in the referral universe. Then when making a referral, they can check the person's referral history to see if that person already has been screened and referred for services in order to reduce redundancy. Not only can service requesters set up their trusted universe to make referrals, they can also search for services outside of that universe when needed. So again, referring back to that 211 database that we'll be bringing in. And lastly, service requesters can set up their organization's preferences for receiving notifications, set up client reminders, and they will receive notifications that our referral was accepted or declined, closing the loop with those closed loop partners. Now, if you're on the service provider side, The service providers can set up the organization's landing page to request specific documents or provide eligibility information. So really capturing a lot of that information up front so that when the person shows up, we can reduce those instances where service providers are stuck where they can't provide a service because they don't have a document they needed from a service requester. So this could really help decrease those instances either by communicating or sharing that document across the platform. Providers can review screening, referral, and service history before the client even arrives, enhancing that experience for the client and avoid having them to answer the same questions over again. So you'll see that screening history. Providers can ensure that people are not referred to services that they're not eligible for by putting your eligibility criteria or just by requesting certain information that would determine eligibility. Providers can use communications within the system to send back requests for incomplete referral packets, et cetera. And again, those client alerts will really go a long way to help decrease no-shows and missed appointments. And lastly, you have that closed loop relationship where you can close the loop and send that feedback back to the service requester. So lastly, we want to assure everyone that the referral system does comply with HIPAA. There will be no additional layers of consent in order to use the referral system. If an organization is sharing PHI through the platform, say as part of a referral, you would follow your normal course of action in regards to releasing that PHI. So for example, a covered entity referring for services would be covered as part of care coordination. If you think of this system as a new modality, so whatever you're currently using for your referrals, whether that be fax, phone call, email, this system would be the new modality for doing that. So whatever consent process you have in place, that same process will remain in place. The timeline, so we're currently in that implementation and planning stage. We will be starting the early adopter stage in June through September, and this will be going live in the fall of 2021. And now I am going to stop here and pass it over to Catherine Crookstone, who's going to give you an overview of NowPow, and they'll be doing a demo. Catherine?
Thanks, Andrew, and hi, everyone. As Andrew said, I'm Kathy Crookston. I lead our partnership team, and I'm very excited to join all of you here today as we kick off our partnership with HealthCurrent and with each of you. And Andrew told you a lot about exactly, what the platform functionality, some of the features, and I'm sure you're very excited to be able to see Sunan bring that to life in the demo. But first, before we jump into the demo, I want to share a little bit about who we are, who NowPow is, because we will be working side by side with HealthCurrent to support them in these efforts. So NowPow is a women-led and founded business on the south side of Chicago. It is the place of our origins. It's where we began. You can see right from the slide a few faces actually in our company. You can also see that we are made stronger by our dedication to diversity. And while our corporate office remains in Chicago, you will have a local team here in Arizona to support you as well. So let me tell you a little bit about the team. Some of the roles and the responsibilities of the team are listed right here on the slide. And over time, you'll get to meet some of the teams that'll be working at the direction of HealthCurrent as we progress through, as Andrew said, the rollout and as we grow this network across your entire state. But some of the roles and responsibilities that are going to be really key to success is your senior account manager, who will be working closely with Andrew and the team to ensure success of the effectiveness of the program. And the community engagement manager, that the team will really be working with those community-based organizations to onboard them onto NowPow and to support that referral management. Additionally to them, you can see all of these subject matter experts. So we're bringing in those subject matter experts for implementation and that launch. Community resources, as Andrew had mentioned, they're going to be working very closely and are already at work building in any of those resources from Arizona 211. The engineering team for any integration work that is happening, and the product support team. Additionally, as Andrew talked about some of the data that we can gather along the way, how do we measure the impact? Measuring that impact will be critical to the ongoing success of your initiative. So let's show you a little bit of what your team, and while they're not all here joining me today, This is some of the team members that'll be working closely with you. You can see to the side, Stacey Navarro, she actually leads our customer success and community engagement team. And many of you will get to know her very, very well. On her team, Natalie, actually living more closely in your neighborhood than ours in Chicago, is actually going to oversee and work closely with Andrew and Clay and others of the Health Current team, and Brittany Lee leading that customer engagement team. And many of the other team members that you can see there are those subject matter experts that come in for implementation and for creating and optimizing that resource directory. Now, Andrew talked about the purpose of really putting this in place. And very nicely, your purpose is our purpose. That whole person care is actually why NowPow exists. And you can see right from the slide, the alignment that we have with the whole person initiative that was really started out in 2019 in Arizona. So the purpose will be around supporting the whole person, all of their needs, the basic needs and beyond, and additionally those needs not just for themselves, but their caregivers or those that they support. The whole communities, ensuring that we take an approach that is sensitive to the stakeholders in the community to bring them on at the capacity that they can, and to ensure that we help you support the entire population across all communities in Arizona. And with that, I'm going to move right over to, building trust. That is absolutely key to any of the success. The risk for a poor referral is to really erode any trust between you as providers of care and those that you care for. So we rely on 3 different elements, and Sinan will really bring this to life. Those elements are a personalized fit. Andrew talked a lot about that. A personalized fit means it must be accessible for someone, they must be eligible, it's got to be close to where they live, work, and play so they can take advantage of a service. For ease, that efficiency is incredibly important. If it's not going to be dovetailed into your workflow, it does not become standard of care. So ease of use. And last, certainly not least, is success will be measured by gathering the data along the way, ensuring that we are understanding the metrics that will actually mean success. And now with that, I will actually turn it over to you, Sinan, so that you can actually dive right into the demo itself and show them a little bit of NowPow.
Thank you, Kathy. I'm excited to take you on a brief tour of the NowPow platform. For the purposes of this demo, I've logged into the browser version of the platform. On the landing page, I can see the most recently interacted with clients. This label can be configured to say patient, member, or even student for an education-based organization. The bell icon on the client's card indicates a message from the individual. You can also view alerts in the Notifications tab. On the right side, here we can see the recently added services right within your community. The service directory is maintained by our in-house community resources team in partnership with Arizona 211. And with that, I'll jump right into the services directory. The Smart Search bar returns service types and organizations with the keyword entered. Our service directory contains 20 service categories that break out into over 200 services that encompass basic SDOH, such as food, transportation, and housing, as well as services to address beyond traditional SDOH needs. Our proprietary taxonomy makes it easy to navigate and search for the right services. Our system of icons makes it easy for you to understand organization or user preferences, and easy identification of closed loop partners. The orange star indicates a user favorite. The pink ribbon indicates a organization preferred service. And the green linked icon indicates a closed loop referral partner. You can search for a service on the go by using the navigation sidebar to find a resource in healthcare screening. I can search for a service that is within 5 miles of a particular zip code, or set it to any intersection or street and update the results. You will be able to leverage NowPow's advanced filtering logic to lower barriers to care, leverage the filters to find the right service fit for your client's needs, preferences, and abilities. Additionally, we can filter by COVID statuses, which are critical as we adjust to the new normal. For example, I can find if a service is currently virtual, delivery, or unavailable. At a glance, you can see the restrictions and details around the service provided. Going into an organization's profile, I can see the overview of the organization, hours of operations, languages offered, and the fee structure and insurance when that's applicable. The tags displayed convey information on accessibility. The services offered at this location are organized into cards displaying service level information. For example, this service is only available by appointment, requires a proof of ID and insurance, and is catered to individuals with cancer over the age of 16. As you can imagine, this information is not readily available by searching on the web. A third of our company is dedicated to building and maintaining our directory by calling the service suppliers and confirming the service level detail on a regular cadence. The resource directory is maintained in collaboration with Arizona 211 on an ongoing basis to provide you with a robust resource directory that can be utilized by all. The recent data verification is listed here. The profile can be translated into any of our 100 languages that are offered to be accessible to the client. This profile can be shared with the client through a nudge, and this is NowPow's terminology for sharing through text or email, both of which work the same. This message in the body can be configured, can be customized and edited, but the key piece is this link that takes them to the external facing profile that I just walked through. Additionally, this virtual card allows them to save the information for this contact in their contact or in their device so that they're able to access it at a later time without sifting through emails or text messages. In addition to the ad hoc workflow that I just presented, NowPow also supports a client managed workflow. You can sort your client database by user, member, ID, or status, or you can search for your client by name and easily finding your individual. The system supports the use of demographic, insurance, and contact information. You will be able to manage communication and contact consent right within the platform. And speaking of communication, the client engagement timeline provides a longitudinal history of all the interaction with the client through her care journey. We can leverage client information to auto-generate a list of personalized community referrals, which takes in their condition and demographics into account with a click of this button. Another way to identify Laura's needs is to match them to the right resources using a screener. You can conduct a screening right within the platform, for example, the Prepare screener. NowPow can also host a custom screener with single select, multi-select, and open-ended responses. As you can see, Laura's information is pre-populated in the assessment, making it easy to complete. I can select the responses right within the platform and capture them. Once the screener is completed, it can be configured to request additional information. The summary page will display the needs identified, and you can save this to the client engagement timeline for a note. This allows all other care professionals to have visibility into the work that's been done with Laura. This is where the magic happens. NowPow's standard algorithm pulls back the two closest resources for the needs that were identified. You can see all of the information and seamlessly send a closed loop referral on behalf of Laura. As you can see, Laura's information is pre-populated and the service requirements and eligibility are displayed with the option to upload documents. Earlier, I saw a question in the chat about the documents, so I'll make a note that the uploaded documents are attached to the referrals and stored in the client's profile. For example, I see that Laura needs to bring a proof of ID and a proof of residence. Those documents can be added through this button here. To further facilitate the referral process and break down barriers, the service providers can embed a required question or a screening or eligibility question right within this referral. Once I've selected the option, as you send the referral to the service provider, the information is shared with the acknowledgement and approval of the client. NowPal has flexible consent options, which can be put in place in accordance with the referral process designed by Health Current. As you move into Laura's tab around referrals, you have the ability to manage and track all the referrals for Laura with transparency into the work being done by the service provider and the outcomes. You'll be able to see if your client was contacted and if appointments or follow-up actions were established. Referrals will indicate successful, neutral, and unsuccessful outcomes along with their details. We also have the option for bi-directional messaging, which I'll show on the service provider side. Now I'm changing identities and moving into the service provider view. In this workflow, service providers can manage new referrals and select accept, deny, or waitlist to indicate and communicate their capacity to provide that service, schedule an appointment for later this month around the same time with any notes. Once the appointment is made, it moves into the upcoming appointments bucket. Here, you'll be able to send a reminder on behalf for your patient so that they have information around the date, the time, and location of their appointment, along with any documents that they need to bring or who they can talk to if they have questions. This really brings down that no-show rate that often burdens CBOs and makes it manageable for them to communicate right within this platform. Once the date for the appointment has passed, attendance and outcomes can be recorded. For example, I can mark that Jamie has attended this case management service and received it. It was successful and he was provided with a matched case manager. Through this, I can close the loop. This information is captured in real time and communicated right back to the service requester's platform. In addition to this workflow, service providers are able to enter in any address for an individual, leverage our custom condition algorithms to find resources around specific conditions that are relevant, and search for any resources with the filters that are applicable. This advanced filter logic helps ensure a high quality referral to match and generate a one-way referral. NowPal provides a light analytic dashboard for service providers, and this is one of our many dashboards with information on referral management, performance, and volume. They use this data often in annual reporting and grant funding. Before our last stop in the platform, analytics, I'd like to summarize the 3 workflows I've demonstrated. You can do this work by utilizing Hyperlocal Directory to search and share a one-way referral. You can leverage client data through ICD codes and screeners to identify and match closed-loop referrals. Service providers can match workflows and share out one-way referrals by using proprietary custom condition algorithms. In our analytics portal, we house 15 live on-demand reports that are available at 4 different levels, from organization to ecosystem, that are downloadable in a variety of formats. For the purposes of this demo, I will select the date range for this match report, select the level at which I would like this report, and run. Once this report is generated, I'm able to share it in a variety of formats internally with my team. In this particular report, I'm able to see the top 10 service provider organizations based on the total referrals that have been sent or shared. This allows me visibility into network partners and ignites conversations around strategic partnerships and programs. The 10 most common service types information gives me an idea around what my population's needs are and how they're being served. For example, I can see a lot of resources around food, and people are traveling quite far to get these resources. This might indicate that we are in a food desert and spark change at a higher level. One report that many are finding useful right now is the demographics report to better understand equity and access. I'm going to hand it back over to Kathy to share more around data and reporting.
Thanks, Sunan, for the brief tour. We know that's just a little bit of an overview of the NowPal platform, but gives everyone an idea of the variety of ways that you'll be able to make referrals. You can do that just by simply looking up that category and service that there's needed. You can utilize the functionality that you might be working with a specific panel of patients or people, or of course you can use those custom condition algorithms, which is great. What is nice is now to be able to go a little bit deeper into actually some of that data, because as we all know, data can guide decisions, and it's important for you to know the data, the level of data that will be available. As Sunan said, I think when we started this roadshow, we said our standard reports were 14 reports at 4 different levels. And as we progressed over the last few weeks, we have 15 reports at 4 different levels, from that user level to the network level. And it's available within that analytics tabs right at hand. Additional to that, we talked quite a bit about the fact that we can create for you custom reports, compliance reports, and have available that raw data package of information on every interaction within the NowPow platform. And last, the ability of our team to work with your teams, to be able to understand supply and demand of the needs that you're seeing against the demand that the supply of resources right within your communities that can lead to changes in infrastructure, policy, regulation, and even reimbursement, as we know. And to understand the well-being and health and well-being of the community and how we're building that network, there are those interactive dashboards for that as well. Everything that we will do at NowPow is to support you in this type of work, building to that community impact, so that every current feature and functionality, everything that we will bring forth, and Andrew talked a little bit about those enhancements, are to support that quadruple aim. Ensuring that we can support your entire population, do so in a way that will be efficient for your care team members. Do it in a way that it will be impactful to be able to measure the impact against the total cost of care and the quality of care. And then, of course, to support you as providers of care and those that you are caring for by making this an improved experience overall. And with that, I'm going to hand it back to Andrew so he can continue with the presentation.
We're coming to the end here. If you are interested in participating, or just getting updates and getting additional information, please complete an interest form on our website. The link is on this slide, and we'll post it in the chat, and you will see it on some additional slides. We really want to emphasize that this is only the first step. We'll send you regular updates on our progress as we move along, and Health Current will reach out to you to initiate planning for your joining the statewide network and to assist with identifying your preferred network and service requester service providers. So this is sort of the first step to kind of get connected with us so that we know that you're interested, and we'll be sure to reach out. So some news that came out recently, Access has expanded the differential adjusted payment program, or the DAP program, incentive to 7 provider types. And part of that is joining, in order to get that DAP payment, organizations will need to join the SDOH program. So you can see the different provider types listed there on the slide. The deadline has changed. It was the end of April, but it's now May 14th. And you can visit healthcurrent.org/DAP SDOH to learn more. We'll put that link in the chat as well. You can see it on the slide. And that is really where you go if you want to register. If you're a provider and you're looking to get the DAP incentive, that the registration form can be found on that website. And you'll see on the right-hand side, we are doing additional webinars just around the DAP program later in the month of April. So if you have questions on that or would like to learn more about that, you can attend one of those, and you can get information on how to sign up for those and when those are on that website link as well. Just one other thing we want to highlight, that we have been getting some media attention. There's an article on healthcare innovation that was released about a month ago. It's a really great article that talks about the referral system and our key partnerships that help make this happen. And this can also be accessed on the Health Current website. And here's the contact information for Clay Cummings, our program manager, and for me. If you have any questions, feel free to reach out to us. We'll be more than willing to meet with you, answer any of your individual organization level questions. And at this point, I'm going to transition into the Q&A portion of our presentation, and Clay will be reading the questions.
Thank you, Andrew. We have quite a few questions, so let's dive right in. The first one is, does the patient have to be enrolled in an Access Health Plan to be eligible for the resources of this program?
They do not. So when we say we want this to be a solution for all Arizonans, you do not need to be an Access enrolled person or client in order to access the services on this referral system. Any person, any age, any insurance can use the system.
Thank you. When you say EMR, are you asking providers to upload all their patients into this service?
So the way that this will work, there are two ways, right? So we will not be wanting to upload, like if you have, say, serve 8,000 people, or maybe you're an organization that has a rotating group of 20,000 people that come in and out throughout a given year. We are not going to upload that entire file of information. One of the functions in how Health Current will be leading this is we're going to connect the NowPal platform to the HIE. So you can upload, like if you have, say, like a high risk list, a group of maybe 50 or 100 people that you're going to be working really closely with, we can load that list as a whole to make it easier. But for the person that shows up at the door, you would just start to type their name in the system, and it would start typing Andrew, and it would pull me up. It would do a call into the HIE, or we would put the information in, like my first and last name and another identifier, and it would kick back, here's the Andrew Tarrix in the system. It would do that call from the HIE, and then you'd be able to select it, and it would pull that demographic information in, and that would then create that profile on the system. Now, if I had already went to another service provider and they already uploaded me, when you type my name in, I'll just come up that way. So a lot of different options, but we are not encouraging, nor will we be importing like 1,000-person panels to the system. We'll do smaller panels and then one by one from there.
Thank you. How can we ensure our programs are listed in the 211 directory?
Great question. So we are working with 211 to bring those services over. If you are interested in using this platform and your services are not in their directory or they're not up to date, this is a great opportunity to do that. Great opportunity to get yourselves on that directory or make sure that that information is up to date. But in addition to that, you can sign up for the platform. We can set up your page as appropriate, working directly with you. And then get that information, make sure that that information is coordinated with 211. So that it shouldn't be a barrier if you're not currently in their database, but they have a pretty robust database, so likely your services are. May just need to be updated if needed, depending.
Thank you. Can you expand a little bit on what it means to share documents across the system? Can a document be stored in the system, attached to a patient's record, and accessed by multiple agencies?
So Sunan covered that. Yes, so you can see where you can send documents with a referral. And then I'm gonna actually pass this to Kathy to talk more about like whether or not the system stores those documents or where those documents go long-term.
Thanks, Andrew. Yeah, so that would be attached to the person's profile. And if it was needed where they could share it and need to share it, that's a great example. If you're sharing along some kind of information that's used for multiple programs, that could be shared along with only those where they need to be able to share it to make that referral and break down that barrier, but it would be attached to the person's profile.
Thank you, Kathy.
What I was going to say, Clay, one thing back on the question of being able to make sure that their referral, any of the community-based organizations they work with, our team is going to work so closely with 211, as Andrew said. We also, the team that'll be working with you to stand up NowPal within your provider group, make sure that we are having you view that provider or that CBO directory, so that if we need to amplify that with any additional services, we would be able to do so at that time and do complete validation of those services.
Thank you. As a provider, can I just enter one patient to receive food service or housing with limited data on my end shared?
Yes. So really the basic information you just need is name, date of birth, and then probably you're going to want address because you're going to want to pick services that are geographically located and appropriate for that person. And then it's just a matter of identifying the needs. So you can determine very minimal amount of information to pull that profile forward. And although you can do healthcare referrals on here, the goal is not for this to be bringing on a whole bunch of healthcare and PHI into the system and load it into the profiles. That is not necessarily what we are looking for, but you can bring some of those documents in and store that. Kathy, did you want to add to that at all? No? Okay, I guess we're good.
That's not. Okay. Are providers considering using tablets like iPads to have patients complete the screening on their own? What are the options for getting data into the system?
So the system is a cloud-based system. It can be accessed on a computer, a phone, a tablet. The workflow that you set up at your practice could feasibly, you could pull up the screening tool on a iPad and have them enter that data. I think you would probably want to stay with the person. Kathy, is there a function in the system to have the patient do that outside of like a patient portal?
So there are a couple of things and right now, if you give somebody a code and you want them to do it on a tablet or be in the waiting room, that's absolutely fine. We have it's called Get Code. And then we're also releasing where you would be able to send out, if you want to send out in advance, you could send out the screening in advance of somebody actually coming in. That might be making it a little bit easier to get that information in before they even come in for their visit. So either of those are options.
Thanks, Kathy. In Sunan's demonstration, she mentioned the custom condition proprietary algorithm. Can you expand a bit on what that means? The search based on what? Is it on disease, or just, can you give us some more info on that?
Absolutely. That is part of Dr. Stacy Lindau's original research and work. So as a subject matter expert and having other subject matter expert within different types of conditions, there are certain algorithms that would identify that if you're a diabetic, there would be certain types of things that would be those wraparound services beyond just their, say, insulin, for instance. As a nurse, I would say, I would take this seriously. Exercise and nutrition and learning how to buy food and a variety of other classes may be incredibly important. So any of the kind of services that would benefit someone, that's just an example. You will see in those custom condition algorithms, we have over 50. There are things like food, housing, and a variety of other ones. It is a very easy way that those algorithms will produce the services that you may recommend. Of course, you can do the screener, as Sunan showed. And we have, for many organizations, created a custom condition algorithm specifically for their intervention. One that comes to mind is for child welfare for one of our clients in Washington, D.C. So that is something that we could always work with an organization if they were interested.
Thank you, Kathy. Have other states adopted a statewide closed loop referral model like this? Has NowPow done this type of installation in other states?
So we have a statewide, I'll give you a couple of examples where we're statewide doing some of the work, and specifically I know one of them was around closed loop referrals. So in Illinois for behavioral health, we have a statewide initiative with IHPA, coordinated network throughout the entire state for behavioral health and for basic needs and beyond behavioral health. It's exciting work and it leads across the entire state. When we think of community information exchange, a very large community that is now blossoming out is in Milwaukee and beyond, as we do is we're kind of working in that area now, talking about kind of moving that upward within that state. Another statewide initiative is our relationships in New Jersey. We're both working with large payers there for a statewide initiative and the provider groups and the CBOs within that community, within those communities. Those are just some examples. I would say, have we taken on at NowPow large, complicated implementations and interventions, both shared, closed loop, and this coordinated type of care? Absolutely. We work with the largest public health systems in the nation in both New York and in Chicago, and with a variety of organizations in both of those to really cover both of those large geographies, about the same size as the state of Arizona. So we're very excited about this work, but we have a lot of reps with it.
Thanks, Kathy. Andrew, we have a request for some clarification. So will Access load all of their members onto the platform, or will each provider need to create their own patient panel in the system?
So, like I said, what I was trying to say before, and I apologize for being confusing on it. So we do not want to be loading large lists of groups of individuals, or large, like your entire, every single person you're serving at your organization, or every person who's on Access. There is the option, if you have like a high risk list, or like a small panel of individuals that you're going to be working with really intensely, we can load that list in. But really the goal is for the system. If someone were to walk in the door, you would say, what is your name, date of birth? You get that information, type it into the system. And if I'm already in there, my profile will come up. If I'm not in there, we'll be building an integration with the HIE, Health Currents HIE. It'll do a call into the HIE, grab that information, and pull the demographic information into the NowPal platform. So then if that person shows up that first day, that would create their profile. So you wouldn't have to ask all that additional information from them. You just have to get some basic information, and it will pull the rest of the demographics in and then create it for that person. And then they would exist when they in the platform, wherever they show up, they would come up just as quickly.
Thank you, that helps. Historically, the data in 211 Arizona is not up to date. What are we doing to ensure that the organization information is up to date, and how often is the information checked to make sure that it's accurate?
Well, I mean, I would point to this as a really great opportunity to make sure that is the case. 211 is not here to really speak to that, so I'm not familiar. But if your service, the services on there are not up to date, this is a great time where we can ensure that they're up to date. We can make sure that they're mapped to the referral system appropriately. And this also will be creating a process for us where we'll be reaching out to everyone who's using the platform on a regular basis to ensure that these service profiles are up to date. And Kathy, I don't know if you had anything to add to that.
Yeah. So there is your referral directory community resource team. They're going to be working side by side with Arizona 211. So while we're building that data infrastructure from the data from 211, we will then validate all of those services down to the service level. That's what they do. So it's great that they're going to make sure, because we want these algorithms to be effective. And you're absolutely right. The services have to be up to date. Beyond that, anyone can request an update of services right through the platform itself. And the community-based organizations, as Sunan showed you, they can even do some levels of information that they want to update on theirs, such as understanding how many people are in the household to make an effective referral, and a variety of other things that they would update on their end as well. So there are a couple of different ways that we will make sure to keep this up to date. I think Sunan showed you one of what we even iterated was the operational status during COVID. So understanding the actual operational status is actually important to accessing the services. So the teams will be working together with 211 to make sure that this is up to date.
Thank you, Kathy. Do we have data on the percentage of onboarded organizations and providers that use the system once it's implemented? Do you have anything like that?
So we didn't share any data, and usually we share a lot of use cases, but this is a brief demo to give you an idea of the platform. The data will differ on the interventions and the need of our clients and how they are using it, but we'd be glad to maybe share a couple of data points within the Q&A. I can tell you from a scale, I can give you an example of somebody who has done some PR around scale in one of our large health systems in Minnesota that has used the platform to be able to go from doing 1,000 to over 100,000 different screenings in the first 10 months is just the operational value of being able to use a platform like this. From a closed loop perspective, another system in Minnesota that comes to mind, and again, I'm trying to think of some of the actual data, that they actually had closed loop referrals at an 87%. Now, some of that means you establishing metrics and goals for what that closed loop referral should be and understanding exactly where you are today and a benchmark so we can measure against that.
Thank you, Kathy. And that will be our last question as we're approaching our time to end here. So we want to thank everyone for joining us today and for your questions. If you did not get your question answered, we will be releasing and updating our FAQ to include any questions that were answered today that are not already on the FAQ. So please go to the website that we posted in the chat. So you can fill out an interest form and you can access the FAQs and any other details or information that you need around the product. Thank you all for joining us today and have a wonderful day.